Ayala, and with the help of Angel Gutierrez and Sierra Lara, we will be discussing image quality factors. These factors will include film factor, geometric factors, subject factors, and the tools to improve the image quality. The term image quality refers to the exactness of the patient's anatomy on the image. Spatial and contrast resolution, noise, and artifacts are the most important characteristics of the image quality. Each of these factors influence the quality of the image and are under our control. Now here are some examples of what you should and should not do.
What makes an image of high quality? Radiographic image quality is the exactness of representation of the patient's anatomy on a radiographic image. A radiograph that faithfully reproduces structure and tissues is identified as a high-quality radiograph. A multitude of things play into factor. No precise way to judge quality of an image has been identified. Some major factors that affect image quality that are under the control of the technologist include film factors, geometric factors, and subject factors. Spatial resolution, contrast resolution, and noise are important characteristics of image quality. In general, the quality of the image is directly related to understanding basic principles of X-ray physics and the factors that affect the quality. Film factors. Properly exposed film appears with various shades of gray, while heavily exposed film appears black. Sensitometry is the study of the relationship between the intensity of exposure of the film and the blackness after processing. This is essential for maintaining adequate quality control. Two measurements involved in sensitometry are the exposure of the film and the light transmitted through the processed film. The characteristic curve is a graphic relationship between optical density and radiation exposure. The toe and shoulder portions of the curve show that at low and high radiation exposure levels, large variations in exposure result in only small changes in optical density. The straight line portion shows that at intermediate radiation exposure levels, small changes in exposure result in large changes in optical density. Best image contrast results from exposure in the straight line portion of the curve. Optical density. Optical density is the degree of blackening on a radiograph. It can be calculated if the level of light incident on a processed film and the level of the light transmitted through the film are measured. The useful range is 0.25 to 2.5. Radiographic contrast shows the differences in optical density. High contrast has distinct differences of black and white or a short grayscale, while low contrast has small or not very distinct differences or a long grayscale. Radiographic contrast is the product of two separate factors, IR contrast, which is inherent, and subject contrast. Film processing. Proper processing is important because the degree of development has an effect on the level of fog density and optical density resulting from a given exposure at a given image receptor speed. Factors that may affect the finished radiograph include concentration of processing chemicals, the degree of chemistry agitation during the development time, and the development temperature. Fog level and IR speed increases with increasing temperature as well as an increasing development time. Geometric factors. Geometric factors are important in producing high-quality radiographs. Three geometric factors that affect image quality are magnification, distortion, and focal spot blur. Magnification is when the images on the radiograph appear larger than the objects they represent. Shape distortion is the unequal magnification of different portions of the same object. Focal spot blur is the blurred region on the image that occurs because the focal spot is not a point and it is the most important factor for determining spatial resolution. The Hale effect plays a role in focal spot blur. The focal spot blur is small on the anode side and large on the cathode side of the image. Magnification. All images have slight magnification. For most exams, minimizing magnification is desired. There are a few exams where some magnification can be helpful. Magnification is expressed by the magnification factor, which equals the image size divided by the object size. It can also be measured by dividing the SID by the SOD. To minimize magnification, you want to use a large SID and a small OID.
Sierra Lotta?
Yes.
Hi. Here, hold my bag of chips. Come on. Let's go. We're going to do your x-ray, okay?
Okay.
Put your chest on the board. Oh, let me have those chips. No, wait. No, honey, your chest. No, honey, your other chest. How many chests do you have? Okay. You good there? All right. Let's see. Scoot over. Can you hug the board? Give it a big hug. All right, I've got a green light. Looks good. Okay, you're gonna take a deep breath, okay? Oh, my chips. All right, don't move. Take a deep breath in. Beep. Sierra Lotta?
Yes.
Hi, I'm Rachel. Nice to meet you. I'll
Nice
be
to
helping
meet
you
you.
with your x-ray. Let's verify your band here. All right, perfect. Come on in. So we're gonna be doing x-ray of your chest, okay? So we're gonna walk right over here and put your chest against this board here. All right. We're at 72 inches for less mag. And we're gonna have you roll your shoulders forward and kind of just give that a bear hug. All right, perfect. Are you okay there?
Yes.
All right. So we're gonna have you take a deep breath in, blow it out. Take one more deep breath in and hold your breath.
Shape distortion. There are 3 factors that contribute to distortion: object thickness, object position, and object shape. Foreshortening and elongation occur if an inclined object is not located on the central X-ray beam. A degree of distortion is affected by the angle of inclination and its lateral position from the center. Spatial distortion occurs when multiple objects are positioned at various OIDs. It increases with objects shifting more laterally from the central ray.
Oh my gosh. Oh my god, my husband's so funny. Okay, come on, let's go. We're gonna do this real quick, okay? Let's come, put your shoulder here. We're looking at your shoulder, right?
Yes.
Which one is it? This one or this one? Which one hurts? Okay, we got it. All right. Let's see here. All right. Look that way to the side. All right. All right, don't move, okay? All right. Don't move, don't breathe. Beep. Okay, Sierra, we're gonna come right over here, Miss Letta. And which shoulder's hurting?
The right
you?
one.
The right one? All right, perfect. So we're gonna place your back up against this board here. Okay, there we go. And we're gonna look and turn to the side. Okay. All right, we're gonna hold that still, okay? Don't move.
Okay.
All right. So go ahead and take a deep breath in and hold it. A blurred region on the image over which we as techs have little control of happens because the effective focal spot has size. This blurred region is greater on the cathode side. Some factors that contribute to magnification also influence focal spot blur. So, when we are looking to magnify anatomy for diagnostic purposes, we must keep in mind that as we increase magnification, we are also increasing focal spot blur. OID and focal spot blur have a direct relationship. Focal spot blur is most important when looking for spatial resolution. It can be calculated by multiplying the effective focal spot with OID and dividing the product by SOD. When trying to minimize focal spot blur, it is important that we keep in mind the use of small focal spots and short OID. Okay, so come right this way, okay? So which hand is it? Your left or right?
The left.
The left? All right, so I don't have a chair, unfortunately, And my table's not working, so I'm just gonna have you stand, okay?
Okay.
All right, just put your hand out. It should be fine like that. As long as I can see your shadow of your hand on the cassette, we'll be good, okay? All right. Is that good? Are you okay there? Does that hurt?
I'm okay.
You comfortable?
I'm not comfortable, but.
Oh, I'm sorry. Well, raise your arm up. Will that help? Right there?
Sure.
Okay, right there. Oh, look at that's perfect shadow. Okay, just hold that right there, okay? Don't move. All right. All right, Miss Letta, we're gonna come right over here. Okay, I got you a chair, so you can just go ahead and take a seat. And we're looking at your left hand, correct?
Yes.
All right, so go ahead. We're just gonna place it there. Perfect, just like that. Okay. So what happened to your hand?
I fell.
You fell down?
Yes, ma'am.
Oh no, I'm sorry to hear that. Oh, where'd you fall at?
In the park.
In the park? Oh, okay. All right, we're just gonna column it down so we don't get anything extra. We just need this arm nice and straight, okay, dear? All right, just hold that right there, okay? Don't move. Now, as you can see with this first image, this is with increased OID. Look how the image is greatly magnified. The hand barely fits on the plate. With image 2, with minimal OID, you get the entire hand. This is what they want. One way that the heel effect affects the image is how the effective focal spot size is not constant across the radiograph. An example would be an X-ray tube said to have a 1 millimeter focal spot, which has a smaller effective focal spot on the anode side and a larger effective focal spot on the cathode side. Therefore, focal spot blur is small on the anode side and large on the cathode side. Because of the differences in sizes, focal spot blur can be seen differently throughout the image. The anatomy position under the cathode side will have a greater amount of blur and therefore poorer spatial resolution. So, in order to reduce focal spot blur, it's optimal to have a small target angle with a long focal spot and object distance. Because of the anode heel effect, you always want to make sure that you position the thicker part under the cathode side. Subject factors have less to do with the position of the patient, but more to do with technical factors. This is where the learning of anatomy and pathology comes into play, where we as techs have to analyze our patients and determine based off of their body habitus and diagnosis how much quantity and quality it will take in order to produce that optimal image. There are 6 different subject factors to consider, which are patient thickness, tissue mass density, effective atomic number, object shape, KVP, and subject contrast. In regards to patient thickness, the thicker the body part, the greater the attenuation. The thinner the body part, the more are transmitted. If all the incident X-ray beam was to be absorbed by the patient, the contrast would be 0, meaning there is no contrast. On that same note, if all X-rays that entered the part exited the part, the subject contrast would be 1. However, since no one has a perfectly even body, chances are the subject contrast will always be greater than 1. The difference in anatomical thickness in our bodies is what contributes to the subject contrast. Dina Reyes? Yes. All right, right this way, please. Just go ahead and get up on the table. Oh, they're having fun over there. Okay, lay down. What's going on, Dina? What happened?
I had this pain on my side.
Pain?
Yeah.
Oh, okay.
And my stomach.
What did the doctors think it is?
I don't know, but that didn't help. Sorry.
All right. Okay, well, everything looks good. Don't move, okay? Don't breathe. Or breathe. Hold on. Well, that looks. Yeah, that looks good. All right. Are you breathing? Wait.
Miss Reyes, can you please put your phone down? Sorry, yeah, you can't. Okay, alright, well, that's fine. Okay, don't breathe. Beep.
Dina Reyes? Hi, how are you today? I'm Rachel. I'll be helping you with your x-ray. Let me just look at your band. All right, perfect. Come on in. So today we're going to be taking an x-ray of your abdomen, correct?
I don't know. Guess
Yes, maybe?
it's my stomach that's been hurting.
Okay, perfect. All right, well, let's get you first to lie down on this table here. Your head's going to go over here, your feet that way. I'm going to put your phone right over here, okay? Watch your head. Sorry about that. Okay. How long has your stomach been hurting for?
Since last night.
Since last night? Did you eat some bad food maybe, or
No,
no?
it's happening in the
Really? All right. I'm sorry to hear that. All right. Okay, so we're gonna have you just place your hands on your side if you don't mind. And in a moment, I'm gonna have you take a deep breath in. You're gonna let it out and you're gonna hold it out, okay?
Okay.
All right. Don't move, okay, Miss Reyes? Okay. She's a little larger of a patient, so we're gonna go ahead and increase that a little bit. All right, Miss Reyes, go ahead and take a deep breath in. Blow it all the way out and hold it out. Don't breathe. Beep. Tissue mass density is based upon different sections of the body that may have equal thickness but different mass densities. This is an important factor when it comes to subject contrast. For example, if we were to cut the same size of fat, muscle, and bone out of our body, though equal in size, the weight and composition of the three are entirely different, so they will all absorb a different amount of X-rays, with the most dense absorbing the most. Another important factor that affects subject contrast is effective atomic number. In the diagnostic range of X-ray energies, the photoelectric effect is of most importance. When there is a large difference of atomic number between close tissues, that is when subject contrast is said to be high, like an image of a hand, for example. When adjacent tissues have low differences, that is when subject contrast is said to be low, like an image of an abdomen. In radiology, we use this knowledge to our benefit. We know that we have the capability to enhance subject contrast by the use of contrast media. Contrast media increases photoelectric absorption because of its high atomic number. So when used, it gives us that high subject contrast image. The shape of an object is another subject contrast factor. If the part of the body that is being X-rayed coincides with the X-ray beam, it is said to have maximum subject contrast. If the part is of any other shape, it is said to have reduced subject contrast. This is due to the part thickness changing across the X-ray beam. This reduction of contrast is also known as absorption blur. Absorption blur reduces spatial and contrast resolution of any anatomical structure, but is worse during interventional procedures, in which vessels with small diameters are being looked at.
KVP is the most important influencing factor for subject contrast, and it is controlled by the radiographic technologist. When using low KVP, a short grayscale with high subject contrast is produced. When using high KVP, a long grayscale with low subject contrast is produced. When the KVP is lowered for exams, the mass must be increased in order to produce acceptable optical density, but the patient dose is increased. With low subject contrast, there is a wider latitude of exposure factors. The mass selection is not so critical with high KVP. Radiographic contrast is the contrast of a radiograph viewed on an illuminator. Radiographic contrast is determined by size, shape, and X-ray attenuating characteristics of the subject being examined, and the energy of the beam. The overall degree of subject contrast is proportional to relative number of X-rays leaving those sections of the body. Radiographic contrast equals IR contrast times subject contrast. Any movement of the X-ray tube or patient during radiographic exposure will result in blurring of the image. The loss of radiographic quality is called motion blur. This can be reduced by carefully instructing the patient. Voluntary motion of the limbs and muscles is controlled by immobilization. The heart and lungs is controlled by involuntary motion and can be controlled with short exposure times. Motion blur can be reduced by using short exposure time, providing instructions, using large SID and short OID.
Sierra Lotta?
Yes.
Hi, come on in. We'll be taking your chest x-ray.
Okay.
Just put your chest on the board. Alright, so go ahead and give it a hug. Right there. Perfect. Alright, Miss Lotta. I'm gonna have you take a deep breath in, okay? So take a deep breath in.
Right now?
Beep. Watching your patient and clear instructions are key to preventing motion blur.
The tools for improving image quality is proper patient positioning, the selection of proper image receptors, and using correct radiographic technique. Each of these individuals must be used properly. If one changes, then another must be compensated. Patient positioning is one of the most important factors. Proper positioning requires that the anatomical structure under investigation be placed as close to their image receptor as is practical, and that the axis of the structure should lie in the plane that is parallel to the plane of the IR. For proper patient positioning, the radiographic technologist must know the human anatomy well. The techniques used to radiograph the specific body part is designed to produce images with minimal distortion and maximum image resolution. The central ray should always be in the center of the body part being imaged. Throughout a radiology department, a standard type of screen film is usually used. When radiographing soft tissue and extremities, fine detail screen film is used. Most radiographs are double emulsion film. Use of intensifying screens decreases patient dose by a factor of at least 20. As the speed of the image receptor increases, radiographic noise increases, and spatial resolution is reduced. Low contrast imaging procedures have wider latitude in producing an acceptable image. Before the technologist does an exam, they must choose proper technique factors that include KVP, mass, and exposure time. Always keep the time as short as possible. The overall image quality is improved because of less motion. The technologist should always strive to obtain optimum radiographic contrast and density. KVP is primary controlling factor of contrast. Mass is a primary controlling factor for density. As you increase KVP, both the quality and quantity is being increased. When increasing mass, the radiation quantity is being increased. Always remember when choosing technique factors that you have to think of LoRa as well.